Hello, everyone. Greetings of the day. I'm Priyanjali from All About Skin Wellbeing. I'm sure all of you must be keeping good health. We all know taking good care of your skin is important for more than just your appearance. As the largest organ, your skin becomes the most essential to your overall health. A fungal infection is very common on your skin or nails. Fungal infections or mycosis are diseases caused by a fungus, yeast, or mold. Mild fungal infections can look like a rash, can be itchy and annoying. So let's connect today with our skin expert, Dr. B. Soorya, live from Erode to enlighten us on the topic of fungal infection. Dr. B. Soorya is MBBS, MD, DVL, medical and aesthetic dermatologist. She has many years of experience in this field. So today, Dr. B. Soorya will be sharing her insights with us on fungal infection. Moving ahead, we would like to welcome you to today's platform, Doctor. The first question for you would be if you can elaborate for us what is fungal infection in your language.
Thank you for the nice introduction. Fungal infection, which is very common, especially in our population as of now, it actually occurs due to increased moisture in the skin and wet skin. And fungal infections are one of the most common sought-out disease among the dermatologists in India as of now, and it has the worst, um what to say, uh, medication used by own medication used by the patients outside the clinic without the consultation of dermatologist or OTC. So it's better consult your dermatologist whether to know properly whether there is fungal infection or not and treat accordingly. Otherwise, you develop resistance for the infection, and it's very difficult to treat if the resistance is developed. And fungus is normally seen by us day to day practice, and it's better to avoid than be with the fungal infection because it's very itchy and it's very contagious and it's very irritating disease to be on. Fungus can cause lot of disease in skin, from seborrheic dermatitis to dermatophytosis and nail infection like onychomycosis and lot else, where it can even start from skin and go systemically. So it's better to consult a dermatologist and get treatment for fungal infection.
Right. Doctor, as clearly mentioned by you, that fungus normally grows in a wet area. And mostly all the folds in our body, which normally
Yeah.
tend to stay wet, especially in the summer season, or now that we are facing monsoon all over India, we should not face monsoon at this time. But due to global warming, we see a lot of regions still facing monsoon, and monsoon has become a major reason why fungal infection uh, occurs. So how do one keep themselves dried all the time? What are the preventions one can take in order to stay away from fungal infection, especially in this fungal infection awareness month?
Actually, fungus is one of the disease which can be easily prevented by few measures. First, the patient should be free of moisture. That is wet. Always use dry cloths, loose-fitting cotton cloths, especially in summer, and usually wipe off the wet areas. Change your wet clothes after your exercise or workout. Immediately take a bath and never share any clothes or personal items like comb or inners or anything with others. Always wash your socks and change it often, and use of antifungal powder or any powder on the force which can reduce the moisture as well as prevent fungal infection. And wash your clothes in hot water and dry it in sun. These are the few measures which, with this, you can
Right,
easily prevent fungal infection. Even cut
right.
your nails frequently, also.
Hmm. Right. Now, doctor, the main challenge occurs is when we have to identify the disease. Skin being the largest organ, we see a lot of things happening in our skin every now and then. So, how does one know that this is fungal infection and this is the time I should visit the dermatologist, or this is the time I should take some preventions?
Actually, fungal infection, like most of the skin disease, it will look same for the patients. But there are
Hmm.
few things which you can differentiate from other eczemas or allergies. First, it will occur in folds like axilla, in the neck folds, in the groins. Commonly it occurs, and it's very contagious. When you touch that and touch at some other area, it will easily spread. And it's very itchy. There will won't be a lot of scaling. There will be scaling, somewhat scaling, but itchiness will be there. And yeah, try to treat yourself with a powder or soap at home. If you can't, please consult your dermatologist because it's very contagious. It can spread within you as well as in your roommates or in your house. People from your family can also be easily affected with it.
Right, right. Doctor, you also mentioned that fungal infection can occur in different parts of the body. Few
Yeah.
of them you have already mentioned. So, does fungal infection in different parts of the body has different cause behind it?
No, normally it will be same. Most
Mm.
of the time, if dermatophytosis, it will be same. There are many variant inside it, but it's normally same. Even seborrheic dermatitis in the scalp, which we call as dandruff, is a fungal infection, which is different from
Right.
dermatophytosis, which occur in the fold. So each area has a different cause and different type of treatment.
Right. So you mentioned dandruff is a kind of fungal infection. We never knew that. I think most of the people who are watching us who never knew that. We,
Yeah.
n- I don't know, but I know a lot of people who don't treat dandruff. They take it as a part of their life. So is it important to treat dandruff? Let's start with dandruff itself. Is it important? How can it affect our skin slowly and gradually? If you could please elaborate.
Actually, dandruff, it is mild. You can use OTC brand shampoos and you can treat at home. But if it's
Hmm.
severe and you have a lot of scaling and itching, it's better to consult your
Hmm.
dermatologist because dandruff can cause hair loss. It can cause acne over the face and increased oiliness over the face, and it also can cause body acne. And severe form of dandruff will similarly look like psoriasis. So it's better to consult your dermatologist and get it treated if it is severe.
Right. Let's move ahead with the next part of the body, doctor. We see a lot of Indian women, mostly their hands are wet because they are busy doing the household chores the entire day. And I have seen a lot of women having thick nails at a very small age, or there are lining in the nails, or the areas beside the nails are mostly affected, swollen. It's painful, and I have seen them almost giving up on it, thinking that this won't get cured. Iska koi ilaj nahi hai. I've heard a lot of women saying that. So is it true? Can it be cured? And is it a little stubborn from the rest of the fungal infections like affecting in our different parts of the body?
Yeah, nail it will only clear very very slowly. Fingernails takes up to 6 months for it to clear the fungal infection, and toenails take up to 1 year. So we have to be very patient with treatment. People has to do their work. They can't avoid their household work. But what will
Right.
I suggest is that they don't actually wash clothes or wash utensils very often. They can finish the work and towel dry their hands or legs. Just don't leave it to dry in the air. And after if you get any fungal infection, it will take very slowly. Please consult your dermatologist because nail infection will not go on its own. It keeps spreading. So once you consult your dermatologist, you get topical lotions as well as tablets. But tablet, we don't give it for a lot of times. It will be monthly, 10 days only for 6 months for fingernails, and toenails, it will take up to 1 year, but it will surely clear. For paranoia, which you said about the swelling around the hand, but we have to treat it acutely. We need to give antibiotic for it. Mostly paranoia is caused
Hmm.
by bacteria rather than fungus. If there is chronic paranoia, that is they get the infection very often, we need to do the preventive measures like using gloves or some other preventive measures for them to use.
Right. Doctor, again, specifically talking about nail because it is a discussion right now. Uh, Tell us, does the nail, how does it cure itself? Does not cure itself, of course, with medication. How does it get cured? Does the nail fall? Do we see a new nail coming up gradually when the fungus has been treated?
Yeah, actually, the old nail with the infection will grow outside. So we can cut it off and the nail which will grow further after treatment will be cleared. So it won't
Right.
fall. The nail won't completely fall off. That's the part we
Right.
it will come and forward, so we can cut it off slowly.
Right. You have been mentioning initially, since the initial discussion of today's live, that fungal infection is contagious. It can spread. So
Yeah.
can this sort of fungal infection also spread?
Nail is very rare, but from person to person, but it can spread from one nail to another in the same person. It is
Right.
contagious inside our body, but it's very rarely spread to others. Nail,
Right.
specifically nail
Right.
fungus.
Right. Doctor, for all the people who are watching us right now who realizes that someone in their family is suffering from fungal infection, and uh, there are times when the family they do spend time together, or as you have already mentioned, not to share personal items, or washing clothes is something which we tend to do on a daily basis.
Yeah.
All the clothes are being washed together in a family household. So can the fungus also spread in such manner?
Sure, yeah, it spreads like that. If the person has any rash, it's better to wash their clothes alone. And normally, families shares everything. Better not to share if the person has any skin rash or anything like that. And always wash their clothes separately in a separate bin, and then wash other clothes. That's how we can prevent. With if they wash this clothes together, it will surely spread.
Right. Doctor, we also see nowadays because of lack of space or monsoon, we are still facing monsoon, the clothes are left undried. Is it important to sun dry the clothes? We see a lot of people drying their clothes inside their rooms or maybe in a dark, shady area. Can damp clothes also lead to fungal infection? And for all the people who are not able to sun dry the clothes because of whatever reason it is, what are the strategies or what are the steps they can take in to keep themselves always dry and away from moist?
It's better to sun dry, but if you can't, at least dry under a fan, and don't use the cloths for at least 1 week if it's very damp. Use different cloths.
Hmm.
After a week, use that. Till that time, it will dry off and the fungus will die. So it's better to use sun dry. If you can't, please at least dry under fan for a week if it is damp, or if it's have dried properly, use it after 2 days.
Right. Doctor, what are the treatments for fungal infections? How do we treat the patients, the first line of treatment?
First line is actually now because of lot of resistance and patients using lot of OTC products like steroid cream, there are a lot of
Hmm.
resistance for fungal infection. So first line has both oral antifungals as well as topical. We give both.
Hmm.
With one, it doesn't cure because of the resistance, and including along with that, we give soaps and powders for follow, and at least you have to take treatment for 3 months. At least a three follow up is needed with your dermatologist, and dermatologist should clearly state that your fungal infection is cured. If don't stop when it's half cured or if your itching is gone, because the fungal infection will come back again. So get it cured completely with your dermatologist, and then follow up with the powder regularly so you don't get it back.
Right. Speaking about resistance, which you have already mentioned, for people who are wondering what are we actually talking about, the tendency of human nowadays to go and get their medications by themselves or asking the chemist कि इस fungal infection के लिए क्या चाहिए होगा. They normally give us some steroids, and continuously application of it can cause lead to resistance, for which the kind of medications which we used to use previously, it has stopped working. So one sort of medication is not working for us. The doctor need to apply a kind of proper treatment, a line of treatment where two or three kind of medications are being given because of the behavior of us. It is also causing trouble for us. It is also causing trouble for the doctor. People who are thinking that we have to visit the doctor, it will take some visiting charge. Basically, money has become a big factor here. But somehow you are spending more money in this manner. Doctor, let's speak about the ozoles. We knew that if it's fungal infection, a common medication was fluconazole. We used to take it widely throughout the world, and we used to get positive results as well. But nowadays we get to see that the doctors are slowly and gradually changing the medications. um, are we saying that if we keep on showing such behavior of medicating ourselves, um, the line of treatment will be changing and such kind of drugs will be stopped using? I mean, we will stop using such kind of drugs in the near future.
Yeah, it will be. That's what we are very afraid of, because we have gone from fluconazole to itraconazole, and we are going back to terbinafine and griseofulvin, which we used to use before. Now, because of the resistance, uh, actually we used to treat fluconazole fungal infection with one sitting with oral fluconazole and topical azoles. But now it takes up to three sittings. First, we will start with fluconazole, then go to itraconazole, then itraconazole we'll lower the dose. So it takes time for us to treat because of the resistance, which the fungal infection which used to get cured with in one sitting now takes at least 3 to 4. And when you use
Mm.
steroid, which people give outside or as a self medication, you are actually doing very very harm to you that rather than any benefit, because with steroid your lesion will go within 2 days, but it will come in a wider form within 5 days. So it's better to avoid steroids. Better don't use any drug rather than using a drug outside the dermatologist clinic.
Right. We always suggest our patients that the self medication is something which is the worst thing you can do to yourself. So please, everyone, stop self medicating. Our experts are always there around you to help you out with the best possible suggestion. Make sure you visit your expert whenever you see any change in your body. Moving ahead, doctor, uh, what is the most serious kind of fungal infection that we get to see?
Actually, there are a lot of fungal infection from skin. It can spread inside. There are a lot mycetoma, even foot. They'll say athletic foot, and lot of fungal infection which can go deep and affect your bones. So if you see any signs of fungal infection, it's better to get treated at the earliest, because it's very easy to treat early. Within 1 or 2 sittings, we can treat it, and we can identify what it is and get treated. If you leave it, then only it will become serious. So, no need to worry about a lot of deep fungal infection as of now. But when you see any changes in your skin, if it is woozy, if there is pus, if there is pain, itching, please consult your dermatologist rather than going in Google and searching a lot of things. Please consult your dermatologist and get it treated very early.
Right. Doctor, another kind of fungal infection we get to see commonly now is vaginal fungal infection or
Yeah.
vaginal candidiasis, what we commonly call as. Um, what can be the reason behind it? The suffering is a lot. It's painful. It's a painful process, we know, because of the um, delicacy of the area. Uh, what can be the reason behind it? Can frequent use of public toilets be one of the reason?
Not very much, but that is also a cause. But yeah, the moisture in that area is the or if the people keep it wet at that area is the most common cause. Public
Mm.
toilet, it doesn't spread like that. Rarely it spreads that way. So it's mainly the moisture in the area. So it's always but please keep the area clean. If you have your menstrual cycle, it's better to use a cotton pads, and frequently change the pad, and keep the area very dry. If you're using a restroom, please dry the area pad, dry it, and that will actually keep you away from fungal and vaginal candidiasis. And even diabetes is a main cause for one of the main triggering factor for candidiasis. So if you get repeated vaginal candidiasis, please check your blood sugar levels also.
Right. Doctor, because you have already mentioned about menstrual cycle and to use a cotton pad or sanitary napkin, what we say is, uh, we see nowadays girls or young teens, they commonly use menstrual cups.
Yeah.
So, how helpful can this be, or can it also somehow cause trouble in the long term? Because there are a lot of things coming up in the market nowadays, and the market is flooded with the exciting things which we would like to try. All of us would like to try. But is it safe? If you could please tell our viewers.
Actually, if you use it properly, everything is safe. It depends on
Mm,
us actually. The menstrual cup actually, if you use it properly, you won't get infection. But if you are using it in an unhygienic manner only, you will get infection. So you can use anything like sanitary napkins, tampons, or menstrual cup, anything you want. But actually use it in a hygienic manner. Clean it, change it very often, and that will be more than enough for you.
right. Doctor, what about immunity? Does our immunity also play an important role in fungal infection? Can having a low immunity somehow trigger the condition?
Yeah, actually, not in a normally healthy person, but the person have any other systemic disease. If their immunity is
Hmm.
very low, then they have increased chance of fungal infection, and the fungal infection will get complicated in those patients, like patients with HIV or some other disease, like if they have if they are on chemotherapy for cancers or any other disease or any other drug which they are taking, which lowers their immunity, they get fungal infection very often, and it can get complicated very often. But
Right.
normal healthy patient, that won't be a problem.
Right, right. Doctor, a major issue with fungal infection is the reoccurrence of fungal infection. There is a tendency of reoccurrence of fungal infection every time when somebody is suffering from fungal infection. So, how can one get rid of it? What is the basic thing one needs to keep in mind if he or she has already suffered from this?
Actually, treat it completely. That your dermatologist should clear you from your infection, that you are cured of your infection. And after that, follow up with the soap in the folds. Sorry, soap powder. Use antifungal powder regularly in the folds if you are sweating profusely, so it can prevent the moisture as well as keep the moisture away. Don't use wet cloths or use a damp neat don't use damp cloths. Use a dry cloth, cotton loose fitting cloths, and always wipe off the moisture from your body. Wash your clothes regularly, cut your nails, don't share your personal items. That will be more than enough to prevent you from further fungal infections.
Right. Moving ahead, doctor, what are the antibiotics which treat fungal infections nowadays?
Normally, we don't give antibiotics for fungal infection. It's antifungal. If there is
Hmm.
a co-infection with antibiotic and antifungal, we'll give antibiotic. Other than that, antibiotic have no use in fungal infection. So you need to use
Right.
antifungal. So don't use
So,
OTC because of this. They give
right,
antibiotic for you rather than antifungal.
right. So, can using this antifungals for a long time have some adverse effect on our health?
If you use with your dermatologist guidance, you won't get any adverse effect. Normally, we don't give it for very long. We'll give for 1 month,
Hmm.
or after follow up, we'll change the medication very often according to
Hmm.
how your lesions respond to the medication. So it's you can take it, but under the guidance of your dermatologist, it's safe to take. No. A lot of side effects will not be seen with that. Minimum side effect will be seen.
Right. Doctor, a lot of people wonders, as you have already mentioned once, that they stop taking the medication after a certain period of time. Uh, is it because they see the kind of changes happening in their skin that this is getting cured now, so maybe I can stop taking the medications? So can this be safe? Can the fungal infection again reoccur if they stop taking the medications at certain stage?
Yeah, 100% it will reoccur if they stop in the middle. Because after 10 or 15 days, your itching will be gone, your redness will be gone, your lesion will start to disappear. But without your dermatologist clearance, please don't stop the medication, because if you stop the medication, next time when we give medication, we'll give a higher medication than the previous one, and it will be very costly for you. So it's better to take medication with your dermatologist consult.
Right. I can see some questions, Doctor, which are coming from the viewers. The first question comes from Riya Sathi, who asks, how does wearing breathable footwear help in it?
Actually, yeah, it matters, because we'll say interdigital space, that is between your toes. If it is wet, you will get a fungal infection there. So usually it's better to use breathable clothing. As well as for that only, we say to wash your socks very often and change it very often, because sweaty foods can lead to fungal infection. So keep your toe dry and interdigital space dry, and use a change your socks very often, and use a breathable footwear is very important point.
Right. The next question, Doctor, comes from Kiara Chauhan, who asks, is it important to keep the skin, how is it important to keep the skin dry?
It's very important to keep your skin dry, because if your skin is not dry, you get lot of infections, not only fungal, there are a lot other more infections you get. So if you keep your skin dry, dryness is different from the moisture, so don't confuse with both. Dry, especially in folds, if you keep your skin dry, you don't get fungal infection or sweating related infections, even malaria, which we say rashes due to bacteria also will not be there if you keep your skin very dry.
Right. The next question, Doctor, comes from Shivam, who asks, how do diabetes and fungal infections relate?
Not all fungal infection is related with diabetes, but diabetes is an important factor for the fungus to get resistance or to get complicated. So if your sugars are not under control, you get frequent fungal infection, and the fungal infections are very difficult to treat, and they get complicated very easily. So please keep your blood sugars under control.
Right. The next question comes from Abhi Kumar, who asks, why is it important to avoid sharing personal items?
Because fungal infection is contagious, it spread from one person to another. If you share the items, if you have fungal infection, you are giving it to the other person. So it's better to avoid sharing the personal items, including to combs, towels, and everything.
Right. Doctor, is there any genetic predisposition as well? Is it possible that somebody is carrying it from their genes?
No, fungal infection is not like that. Genetic predisposition is not a factor in fungal infection. It occurs
Right.
just like any other infection. It is not genetically predisposed.
So what if a woman is during her pregnancy and she is suffering from fungal infection? Can the child also get affected it by somehow?
No, if it is in vaginal area and she is having normal delivery, if not treated, rarely it can spread. So it's better to
Hmm.
get treated during your pregnancy. Don't be afraid the doctor will give medication that will have lot of side effects. We don't give any medication with side effect during pregnancy. We are very careful with that. So it's better to get treated during your pregnancy. But during breastfeeding or something, if the patient has any lesion on the exposed side and the baby is
Hmm.
touching that side, then it
Hmm.
can spread from the mother to baby. Other than that, from
Right.
pregnancy, it doesn't spread.
Right. And can oral antifungals be safe for a pregnant lady? Is it?
Yeah,
Do
certain
we normally give them?
fluconazole is safe. Yeah, fluconazole is safe, but it is safe after 5 months of pregnancy. So please consult your dermatologist. Normally, we give only topical for starting. If the patient doesn't respond, we'll go with fluconazole. Fluconazole is very safe during pregnancy as well as breastfeeding. So don't be afraid to
Right.
take the medication.
Right. The next question, doctor, comes from Meena, who asks, how can fungal infections affect the lungs?
Yeah, normal dermatophytosis or seborrheic dermatitis doesn't affect. There is a fungal infection which is specific for lungs. Like there are a lot of fungal infection like mycetoma or many other infection which are very deep. that can spread it to your lungs, and it can affect many other organs, not only lungs, lot of other organs. Like in COVID, you get a deep fungal infection. Like if you people remember, that can affect your lungs, but not every fungal infection, normal fungal skin infection doesn't affect your lungs.
Right. Doctor, for all the people who are worried about the stubbornness of fungal infection, tell us how long does it normally take someone to treat the infection in the initial stage if they go and visit the doctor whenever they see the change? How long does it normally take?
Actually, if you haven't used any OTC cream like steroid or any other cream, it will go in 1 or 2 months completely. Within 10 or
Mm,
15 days, your lesions will start to disappear, your itching, redness, everything will reduce. But it takes at least 2 months for completely cure infection. So you need to visit your doctor at least twice for it to get completely cure a fungal infection if you haven't used any OTC cream or anything, or if you comes in early stage.
right. The next question, doctor, comes from Sweta, who asks, can fungal infection lead to organ failure?
No, that's what a normal skin fungal infection doesn't lead to organ failure. That there are many deep forms of fungal infection that can lead to organ failure, mainly in persons who have very low immunity. Normal healthy person will not have that problem.
Right. Doctor, we get to see a lot of people who are very much physique conscious nowadays. So gym is the area where most of the people goes, and it is not possible to clean up all the equipments every time. There are slots, we know that. So it becomes a challenge to almost clean it every single time. So can sweat also be another reason for the transmission of fungal infection? Is it possible that somebody gets it from the gym and carries it out from there?
No, actually, that is very rare from the equipments. That's what we normally advise. Because of sweating, you get not the other person until you share your personal items. The equipments normally generally don't spread the infection. It's better to have a bath after your workout very, very soon,
Mm,
so you don't get any infection, any sort of fungal or any other infections.
right, right. Doctor, what about diet? Does diet also play an important role when we are talking about fungal infection? Are there any do's and don'ts in such case?
No, there is no diet restriction for your fungal infection.
Right. Uh, 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 we know that either there has to be a dietary restriction or there has to be a lifestyle restriction. So what are the lifestyle changes which one can take in order to get away from or stay away from fungal infection? We know hygiene is a big reason
Yeah.
why fungal infection takes place or occurs or reoccurs again and again. So apart from that, what are the things one need to keep in mind?
Nothing else. Just your hygiene matters for fungal infection. If you're hygienic,
Mm.
take bath twice daily. Don't use wet cloths. Always wash your clothes and cut your nails properly. Don't share your personal items. That is more than enough to prevent your fungal infection. No need to do a lot of lifestyle modification for fungal infection.
Right. Doctor, can long-term antibiotic use lead to fungal infection as well?
No, long-term antibiotic use can give resistance for antibiotic, but that doesn't cause
Hmm.
any fungal infection.
Okay, okay, right. The next question, doctor, is are there any vaccines which are available for fungal infections?
No, there is no vaccine for fungal infection as of now.
Right. So I believe these were the questions which we had to ask. We had a very informative session. We got a lot to learn from you today, doctor. Before we take a leave, any take-home message for our viewers who has watched us so far?
Um, Fungal infection is very normal nowadays. So usually identify at early stage, and please consult your dermatologist. Do not self-medicate. Please do not self-medicate. You're doing more harm rather than any benefits for your skin or your infection. Uh, uh, Personal hygiene is very, very important for your fungal infection. Just maintain that. That is more than enough, and get treated with the board certified dermatologist and get it cleared with them. then move on. Don't stop your medication in between. Do not self medicate.
Right. So that was the expert advice for today, and that was Dr. B. Soorya for all of us. Thank you so much, Doctor, for your valuable time. It has been a very informative session for our viewers today, and we look forward to many more such sessions in coming times. Also, thank you, viewers, for your excellent participation. For more information and updates on skin health and care, stay connected on our Facebook page, All About Skin Wellbeing. We are also available on YouTube, Twitter, and Instagram. Thank you. Stay safe and
Thank,
stay healthy.
thank you so much. Thank you so much. I had a lot of fun being with you guys. Thank you.
Thank you so much. Thank you so much, Doctor.